and that includes some healthcare facilities, most notably Memorial Medical Center in Savannah, Georgia, as well as the Southeast Georgia Brunswick campus, as well as the Southeast Georgia Camden campus. So we've been working with our state and local partners, particularly the Georgia Department of Public Health, as well as those facilities to coordinate the transfer of patients out of those facilities to us. As of this morning, and particularly late into the night last night, actually we were focused on transferring the most critical patients and the most vulnerable. That would be our neonatal intensive care unit patients. So last night we received 12 neonatal intensive care unit patients that were brought to us via a variety of means, including a large number via helicopter with our critical care transport teams and neonatal transport teams. Our team is actually, I believe, en route now to pick up some additional patients, and we'll be getting those neonatal intensive care unit patients. In addition, we've received a number of transfers from those facilities as well as some of the coastal areas of Georgia and South Carolina, including approximately 56 patients as of this moment that have been transferred to us. We're still working with our state and local partners to coordinate those transfers, and we expect many more additional transfers.
As an academic medical center, we are a perfect place for these patients to come to because we can take care of really any level of care. And these patients are coming with staff, they're coming with their family, and so one of the things that we're doing to create capacity is also making sure that we're discharging as many patients as we can today and over the weekend, not knowing what we're going to exactly expect next week. So we've been very diligent, our entire team. Dr. Coule's been really leading that effort, making sure our physicians are rounding, that families are ready to accept their patients back at home so that we can take care of not just these transferred patients, but all of the patients in our local region and the city of Augusta.
I'm particularly proud of our staff that has pulled together as a team, particularly our neonatal team, our neonatal physicians, as well as our trauma staff are working particularly hard to take care of these patients. As you know, those are unique capabilities here, and we're glad that the team is coming together and working really hard to make sure that we're taking care of these patients.
Can we answer any questions?
Yes, can you elaborate on resources? You mentioned that some of these patients are coming with staff, but just talk about your machines and how you're accommodating everyone.
Well, I can certainly say that many of our neonatal intensive care babies have actually arrived with their staff. So the staff came with supplies. The children were transported separately, but last night at about 11 o'clock, we greeted 6 neonatal intensive care unit nurses from Memorial, and we were pleased to see them, greeted them at the front door of our children's hospital and welcomed them in, and some were doing day shift, some were doing night shift. We gave them accommodations, we gave them food. They were registered here and badged. So that's just one example of how we're accommodating them. But in terms of being an academic medical center, we can take care of any level of patient. We have trauma capabilities, we have critical care capabilities, we have regular med-surg capabilities, we have a robust ED for both children and adults. So I really feel like, Phillip, we can handle anything. Don't you agree, Dr. Coule?
Yeah, and the team has been working incredibly hard. Particularly also, we have an aggressive volunteer effort that's ongoing with our volunteer services coordinator that are connecting the volunteers from our campus, including our students and employees, particularly from our academic side of the operation, that are volunteering to assist in some of the sheltering effort in town in coordination with the local Medical Reserve Corps, as well as the Richmond County EMA, Augusta EMA, as well as public health. And so in addition, our critical event preparedness and response team has just done a stellar job of pulling all of this together, both as in their function to coordinate the efforts and make sure that we're prepared on the campus for the possibility of actually having storm impacts, but then also because they are coordinating the effort in conjunction with our city partners and state partners on the healthcare side. So the whole team has just done a tremendous job in coming together to prepare for this event.
And I think we learned a lot from Hurricane Matthew, and so we wanted to make sure that we were ahead of it a little bit more in terms of making sure that we have more than 250 volunteers already registered, already going through the processing, and so we'll be ready to deploy them the moment that they're needed in the region.
And what would they be deployed?
So we're already scheduling those personnel that have been through the clearance process for that. We're already scheduling for them to assist. Our biggest concern will be for the functional needs shelter that's being stood up. And so we'll be providing assistance there, and that will all be coordinated through the Emergency Operations Center of the District Health Office.
And that's in Florida?
No, our District Health Office here locally. So part of the effort here, particularly for our volunteers, is that we've asked people, we're certainly concerned about what's going on in Texas and what's going on in Florida, but we need to make sure we take care of our own community. And as Georgia's academic medical center, we certainly believe strongly in that. So we're looking to make sure that we're assisting our local partners in the area with emergency management. So we'll be assisting and deploying those volunteers to the shelters here locally for the people that are displaced from Savannah.
Once a day, we are on the phone with all of the coordinating centers across the state, and then we have an emergency preparedness team here filled with many leaders and many experts, and we also have 2 group calls every single day, which we will continue through the weekend and early next week to make sure that we have up-to-date information on the patients who are needing to be transferred, for what's happening with the weather and the hurricane, because it keeps changing directions and time and wind speed. So we want to make sure we're completely on top of it.
And what do you tell folks who may need to come here to the emergency room and they may not have a serious thing? Are you just sort of saying, make sure it's serious if you come, because we are tending to the needs of others? Or what would be your advice to folks who are sort of those chronic ER visitors?
So as an emergency physician, I can tell you it can be difficult to sort out what is serious and what isn't. That's part of what emergency physicians do. As much as possible during this event, we're certainly going to have to rely on our emergency physicians and emergency nurses as part of the team to help deal with those issues. But as much as possible, we're trying to make sure that we keep the emergency department offloaded. Part of our effort here is to make sure that we're able to deal with conditions that people in a shelter may have before the event, before it becomes an emergency. Otherwise, we're trying to maintain business as usual, including our clinics remaining open on Monday, because we have patients that have healthcare needs, and we're going to tend to those, as well as our regular operating room schedule on Monday. So we've been able to manage this capacity very well and flex up in order to take care of this. So we're trying to make sure that we, for our normal business as much as possible, and we anticipate being able to do that through this event, at least through the early stages of it, depending on what happens with the weather.
Now, certainly if the weather changes, I'm sure our message will be only come in the event of an emergency. But for right now, as Dr. Coule said, business as usual, but trying to make sure that we're geared up for any type of catastrophe. You're welcome. Thank you.